of MCQs. Question number 1. Which of the following muscular disorders is a progressive inherited genetic condition? The options are A. Muscular dystrophy, B. Tetany, C. Myasthenia gravis, D. botulism. The answer is A. Muscular dystrophy. Muscular dystrophy, it refers to a group of genetic diseases characterized by progressive weakness, degeneration of skeletal muscles. Next question. Question number 2. Malaria, a major tropical infectious disease characterized by cyclical fevers, is etiologically classified as viral disease, bacterial disease, fungal disease, and protozoal disease. The answer is protozoal disease. Next question. Question number 3. In the management of organ transplant patients, hyperacute, acute, or chronic rejection is primarily prevented or treated using options are A. Monoclonal antibody exclusively, B. Immunosuppressive drugs, C. Immunostimulatory drugs, D. T cell stimulants. The answer is immunosuppressive drugs. Yes. The immunosuppressants like calcineurin inhibitors, antimetabolites, and corticosteroids, they dampen host immune surveillance to protect the allograft. Next question. Question number 4. Patients who engage in IV drug use, IVDU, carry a profoundly elevated risk of acquiring which pair of chronic blood-borne viral infections? Options are A. Hepatitis B and E, B. Epstein-Barr virus and cytomegalovirus, C. HIV and hepatitis B, D. HIV and hepatitis A. Next question. In a female patient presenting with secondary amenorrhea, a comprehensive clinical evaluation, it should consider which of the following etiologies? Options are A. All of the above, B. Severe psychological stress, C. Pregnancy only, D. Chronic systemic illness and poor health. The answer is all of the above. Secondary amenorrhea can stem from psychological states like physiological states like pregnancy, functional hypothalamic disruption due to stress, or nutritional and metabolic depletion. Next question. Question number 6. Pathophysiology of a medical science is strictly defined as the study of options are A. Normal undisturbed physiological baseline of host, B. Anatomical structural changes seen microscopically, C. Altered or disordered physiological processes induced by a disease. This is the answer. Next question. Question number 7. Fibrofatty thickening of arterial walls primarily driven by subendothelial cholesterol deposition and inflammatory plaque formation. It is designated as nothing but atherosclerosis. That is the definition. Next question. Development of micronodular or macronodular cirrhosis of the liver globally is most frequently associated with chronic intake of alcohol. That's the answer. Next question. Which of the following neuromuscular or hematological disorders is transmitted via an autosomal linked dominant inheritance pattern? Autosomal linked dominant inheritance pattern. The options are A. Hemophilia A, B. Sickle cell anemia, C. Myotonic dystrophy, D. Thalassemia. The answer is C. Myotonic dystrophy. It has both type 1 and type 2. It is a classic example of autosomal dominant disorder showing anticipation due to nucleotide repeat expansions. Next question. A patient presents with high-grade fever, relative bradycardia, abdominal pain, and a positive Widal test. The primary pathogen responsible for the clinical presentation belongs to which genus? So, high-grade fever is there, relative bradycardia, abdominal pain. All of them are indication of typhoid. The answer typhoid is called by Salmonella typhi. So, Salmonella enterica, cirrhosis, typhi, and paratyphi, they cause enteric fever, classically presenting with stepladder fever, relative bradycardia.